Welcome to The Explainer. Today, we're going to pull back the curtain and look past those perfect after photos. We're diving deep into the high-stakes science behind cosmetic injectables, exploring what's really happening inside that syringe, what's going on underneath the skin, and what it truly takes to master this craft. So here's our game plan. We'll kick things off with the different kinds of products out there. Then, we'll map out the critical facial anatomy that injectors have to navigate. From there, we'll get real about the serious risks and then cover the emergency protocols needed to handle them. And finally, we'll explore some pretty surprising medical uses for these very same substances. All right, let's jump right in with the thing almost everyone thinks of first, using neurotoxins to smooth out wrinkles. I mean, we've all seen these incredible before and afters, right? But getting from that before to this after, well, it's so much more than just a quick poke with a needle. It comes down to a really deep understanding of the products themselves. Okay, so this is where it gets really interesting. You hear the word Botox thrown around all the time, but here's the deal. These products are absolutely not interchangeable. Take a look at Dysport. It's roughly 2.5, maybe even 3 times as potent as Botox. So what does it actually mean? It means a skilled injector has to be part mathematician, calculating the dose perfectly. We're talking about a game of millimeters and molecules here, because a miscalculation doesn't just mess up the result, it can cause the product to spread to muscles where you definitely don't want it to go. And that brings us perfectly to the next piece of the puzzle. See, it's not just what you're injecting, it's all about where you're putting it. The face is this incredibly complex landscape of muscles, nerves, and blood vessels. So an injector might start with a textbook pattern, something like this for the frontalis muscle. That's the big one that raises your eyebrows. But here's where the real art and science come together. The best practitioners know this is just a guide. They have to customize this map for every single person's unique face. So let's go a little deeper. What's really going on under there? What is that needle actually trying to navigate? And here it is. This is that high-stakes map we've been talking about. Just look at that. The muscles in the face are layered kind of like a cake. If you inject a substance meant for a deep muscle too high up or the other way around, you could hit a completely different muscle group. It is a true three-dimensional puzzle. And when a mistake happens, boy, can it be obvious. For example, if that neurotoxin drifts down from the forehead and hits the levator muscle, that's the one that lifts your eyelid, you can end up with something called eyelid ptosis, a droopy eyelid. Now, it's usually temporary, but it's a pretty significant and, unwanted side effect. But believe it or not, a droopy eyelid isn't even close to the worst-case scenario. When we switch gears from neurotoxins to dermal fillers, the gels used to add volume, the potential risks, well, they escalate dramatically. Yeah, we're moving way beyond a little bruising or some temporary swelling now. We are entering the territory of real and sometimes truly devastating medical emergencies. And this is the complication that keeps the best injectors up at night. It's called vascular occlusion. Just imagine, the filler, instead of going where it's supposed to, accidentally gets injected right into an artery. It acts like a plug, like a dam, and it immediately cuts off the blood supply to all the skin downstream. And if that blockage isn't cleared, right away, the tissue starts to starve for oxygen. That leads to necrosis, tissue death. And this photo, I know it's tough to look at, but it shows you exactly what that looks like. That kind of damage can be permanent. And then there's the truly catastrophic outcome. If that same blockage happens in an artery that feeds the eye, the result can be immediate and irreversible blindness. To put that into perspective, one 2013 review looked at just 61 cases of this complication, and 12 of them resulted in blindness. 12. Okay, I know that sounds absolutely terrifying, and frankly, it is. So how do skilled, responsible practitioners prepare for a potential disaster like this? Well, they have an emergency playbook, and they train for it. The number one tool in that playbook, the absolute MVP, is a substance called hyaluronidase. Think of it like an antidote, a rescue drug. It's an enzyme that can literally dissolve the most common type of filler, which is made from hyaluronic acid. The goal is to clear that blockage and get blood flowing again before any permanent damage is done. So a prepared clinic, they don't just have a dusty bottle of this stuff in a cabinet. No way. They have a strict, clear protocol that they have drilled over and over. The second they suspect something is wrong, boom, They stop the injection, they flood the area with hyaluronidase, and they start other urgent steps to minimize the damage. There is literally no time to waste. You know, this quote from a leading textbook really just says it all. The fillers themselves are getting better and more powerful. But when they're in the hands of practitioners who don't have that deep, vital knowledge of anatomy, that's when these terrible things can happen. It's why that expertise is absolutely non-negotiable. Okay, so after all that heavy stuff, let's completely switch gears. Because these same substances have an incredible therapeutic side that goes way, way beyond just cosmetics. Take hyperhidrosis, for example. That's the medical term for severe excessive sweating. For people who deal with this, neurotoxins can be a total game changer. By injecting them in places like the underarms, you essentially block the nerve signals that tell the sweat glands to go into overdrive. This test you're seeing literally shows the practitioner where to target the treatment. And it doesn't stop there. The very same neurotoxin that smooths wrinkles is also a powerful FDA-approved treatment for chronic migraines. By injecting it into specific muscles in the head and neck, it can interrupt pain signals. For patients who have tried everything else, this can bring a profound sense of relief. And that really brings us full circle, doesn't it? From smoothing a wrinkle to stopping a debilitating migraine. These injectables are potent medical tools. And that leaves us with a really important question. As these tools get more powerful and more accessible, how do we make absolutely sure that the skill, the knowledge, and the preparedness of the person holding the syringe always comes first?